Alrighty then, let's talk about mental disorders and criminal behavior. Um, you might think, well, gee, Dr. Day, you could have started with mental disorders in general and then gone to psychopathy. But remember, psychopathy is not considered a true mental disorder. Okay, bye-bye, Pippin. Apparently, Pippin did not want to be in the video after all. That's my wife's dog. Well, yeah, we'll call it a dog. Actually, I call him the scarf that arfs, but wife calls him a dog. Okay, mental illness. Let's define it. How about I define it? Mental illness is a disorder of the mind that is judged by experts to interfere substantially with a person's ability to cope with life on a daily basis. To some degree, mental illness is thought to impair an individual's ability to make rational choices. Mental disorder may be a better term than mental illness because it does not imply that a person is sick or ill, but the terms mental illness, mental disorder can be interchangeable. Psychologists prefer illness, legal professionals prefer disorder. You can guess why. Mental retardation or developmental disability, on the other hand, is a cognitive deficiency that cannot be cured. Most people suffering from retardation can be provided with training and support services, however. We've already talked about the DSM, so I won't talk about that again. Sorry, I have lecture notes here. Blah, blah, blah. Okay, who cares? One thing I didn't tell you about the DSM-4 in part. One of this video is that there is, for years now, the APA has been talking about putting out a 5th edition of the DSM, and we'd quit calling it, we'd have the DSM-5. It was supposed to be published this year. I haven't seen it yet. The first time I taught this class, I said, and it's supposed to be published this year. I first taught this class 2 years ago at Sam Houston State, and told students, and later this year we'll have a DSM-5. It ain't out yet, so don't hold your breath. But when we talk about the DSM-4, remember this is the guidebook for clinical psychologists who seek to define and diagnose mental disorders and justify treatment. There are 2 principles that guide the DSM definition of mental disorder. And in particular, if we're going to talk about mental disorder, we really need to stick to the DSM definitions, primarily because that's how the rest of the world does it. These 2 principles that guide the DSM. First is that a mental condition must have negative consequences for the person. If you're hearing voices and it doesn't have any negative consequences for you, if the voices you hear tell you to act right and be kind to your neighbor and study and do your midterm, well, it's not a mental disorder. You just talk to yourself. Don't worry, we all do. And the further you get in your education, the more you'll do it. I guarantee you, if you ever try to work on a PhD, you'll not only talk to yourself, you will argue with yourself quite often. The second principle guiding the DSM-4 definition of mental disorders is that the disorder is assumed to be a dysfunction of some sort of internal process. In other words, something wrong up here. Note, however, not everyone with a mental disorder is crime prone. So in other words, not everyone who has a diagnosed mental disorder has a predisposition towards crime. And even if a person is diagnosed with a disorder, they can be held criminally responsible for their actions. And those are a pair of important things to know. There are 4 categories of mental disorder that are relevant to crime. These are schizophrenic disorders, paranoid disorders, mood disorders, and personality disorders, such as antisocial personality disorder, which we've kind of sort of talked about, but not really. So let me start by talking about Let's try this again. Let me start by talking about schizophrenic disorder. Schizophrenic disorders are those disorders most associated with crazy people. As it often, schizophrenics tend to, their behavioral manifestations seem to be unusual or strange. When you think of the crazy old guy down the street, when you think, if I say crazy person and you get a mental image, you're probably thinking of a schizophrenic. Schizophrenia is a disorder that tends to begin early in life and often leads to social and economic impairment and tends to have lifelong effects. Behavioral manifestations of schizophrenia are varied. There are a lot of them. But there are some common characteristics. And these common characteristics of schizophrenia include delusions. Delusions are defined as bizarre false beliefs, like there's no God. No. If there's atheists out there, well, I don't really care if I offended you. Sorry. Delusions, bizarre false beliefs. These beliefs seem real to the person with the schizophrenia, but they're not real. So the schizophrenic, they think these beliefs are real. Everyone's out to get me. But in reality, no one cares. But the schizophrenic, it's real. Second behavioral characteristic or common characteristic is hallucinations. Whew. It's not my day for pronouncing words. You'll just have to figure out what the heck I mean, I think. Hallucinations involve sensing or perceiving things or events that others do not. Pink elephants on parade. Disorganized speech. No, I am not a schizophrenic. People with schizophrenia speak very little. See, I'm not schizophrenic. Others have speech that is disjointed. No, I'm not schizophrenic. Sometimes the person will change topic midway through a sentence. Still no. Fourth, schizophrenics have grossly disorganized behavior. By that, we talk about negative symptoms include social withdrawal, an absence of emotion or expression, reduced energy, reduced motivation, just don't do a whole lot. Sometimes people with schizophrenia have very poor hygiene and grooming habits on top of it. See, I've sort of combed my hair today, even if I do have disorganized speech a little. We also have inappropriate affect. That's affect with an A, not effect with an E. Affect, remember that affect refers to emotional reaction. Inappropriate affect, this is an affect type that represents unusual affective expressions that do not match with the content of what is being said or thought. For the guys in the class, you know how women cry during happy moments? For us, that would kind of be an inappropriate affect, but not really. And I love these videos. The ladies can't throw anything at me when I say stuff like that. The person that laughs at funerals or expresses excitement in a car accident. That's an inappropriate affect. The guy that cries during stand-up comedy routines, unless he's being picked on, is an inappropriate affect. You get the idea. There are five subtypes of schizophrenia. The first is the disorganized type. Here we're talking about an inappropriate affect and marked incoherence and disorganization in thought patterns. That's the disorganized type. There is the catatonic type. This is characterized by severe disturbances in muscular and voluntary movement. That may include extended periods of mutism, as are senseless repetitions of words or phrases. Third. There is the paranoid type. Everyone's favorite, the paranoid schizophrenic. This is characterized by delusions and hallucinations. Paranoid schizophrenic may be characterized or may be convinced that others are out to get him, hear voices to tell him things. What was that Mel Gibson movie? The one where he's a taxi cab driver. Conspiracy Theory. There would be a decent example of paranoid schizophrenic, probably one with OCD as well. There's the undifferentiated type. You got to have the undifferentiated because psychologists got to have the catch-all category. This is psychotic. This is the individual with psychotic symptoms that cannot be classified into any of the other categories. They display symptoms that just don't fit, and so there's a catch-all category. And then finally, you have the residual type. This is the person who has had at least one episode of schizophrenia, and there is some evidence that the symptoms are continuing. So this is the individual that might have an isolated incident of disorganized speech, and there's some evidence that it's continuing, but this is kind of the person we think might be a schizophrenic, but maybe not. So we'll put them in there. We know they've at least had the incident. They've maybe had an event that could cause them to be classified as a schizophrenic, and we think those things may be continuing, but we're not sure. We call them residual. Again, we got catch-all categories. All right, second type of disorder related to crime are delusional disorders. So this is different. We're done talking about schizophrenics. Now we're going to talk about delusional disorder. The delusional disorders are characterized by the presence of one or more non-bizarre delusions that persist for at least 1 month. And I know you're going to ask, what's a non-bizarre delusion? Well, because that would be my first question, and so I'm going to tell you. A non-bizarre delusion is one that is reasonably believable and not completely far-fetched. And so this is not everyone's out to get me. This is something that could happen. Delusional disorders often accompany other disorders such as schizophrenia and depression. The key is that the person believes that they're being spied on, cheated, conspired against, followed, drugged, maliciously maligned, harassed, obstructed. Again, the character from Mel Gibson's movie Conspiracy Theory would also be a good example of this. These beliefs are generally followed by anger, resentment, occasionally violent behavior. There are other types of delusional disorders in the DSM, but the persecutory type, this individual who thinks he's being cheated, conspired against, drugged, maliciously maligned, that individual, that's the one most commonly associated with crime, though understand that there are other types. They're just not relevant to us right now. The third category of mental disorders related to crime are depressive disorders. Depressive disorders come with a variety of labels, such as affective disorder, mood disorder, bipolar depressive disorder. The most common label is major depressive disorder. Symptoms of depressive disorders include an extremely depressed state that lasts at least 2 weeks and is accompanied by a slowing down of mental and physical activity, gloom, feelings of gloom, despair, feelings of worthlessness, and perhaps frequent suicidal ideation, suicidal thoughts. It's also characterized by extreme mood changes with long and deep periods of depression. And extreme followed by extreme euphoria, referred to as mania. We used to call these people manic depressives, or this is people we call bipolar now. We may by now have another term for it. Again, this is the long period depression followed by the euphoria or the mania stage. Depression has been strongly, or depressive disorders are strongly associated with delinquency. You work in juvenile delinquency, you will find a large number of your clients suffer from some sort of depressive disorder. This is especially true among teenage girls. As someone who spent 6.5 years working with teenage delinquents, I can tell you from experience, this is true. And let me tell you, dealing with someone with depressive disorder is an adventure. Because they're generally not bad people. When their medication is working, When they're neither in the extreme depression or the extreme mania, they're fairly intelligent. The ones that I worked with were fairly astute, um, pleasant to talk to, nice people. Um, During the depressive disorder, you have to watch them real close because they have the suicidal ideation. Um, they might cut on themselves, not as suicidal means, but just cut on themselves. In their manic stage or the mania stage, oh my God, um, they're just a handful. I'll just leave it at that, handful. Um, think think a just a handful. We'll leave it at that. These depression causes teenagers to become indifferent to their personal safety and the consequences of their actions. So clinically, researchers say it's not just the manic stage, the mania, the euphoric stage that's related to delinquency, but both the depressive and the mania stage. Depression has also been associated with workplace violence, mass murder, and suicide by cop incidents. Suicide by cop, for those of you non-police officers unaware of that phenomenon. Suicide by cop is when an individual creates a situation that puts law enforcement in a position where they feel they have no choice but to use deadly force. And so, this might be the individual that, for instance, wants to kill themselves, but doesn't want to invalidate his life insurance policy. So rather than commit suicide, he points a gun at a cop and threatens and makes the cop shoot him. Another example of depressive disorder is postpartum depression. Probably one that we can think of. Remember Andrea Yates. There's an example of someone in the news within the last 5 years or so that's committed criminal acts as a result of a depressive disorder. There are like 3 different types. Now, this was something when I started teaching this class I didn't realize. I thought depression was depression. Postpartum depression was you got depressed after the baby came, and I didn't know there was. But there really are 3 types. There is postpartum blues. This is not Taj Mahal, singing the blues, but postpartum blues includes crying spells, irritability, anxiety, some confusion, rapid mood changes. It's fairly common. 50 to 80% of women suffer from postpartum depression, this postpartum blues, within the first 5 days after delivering a child. It happens. It happens fairly frequently. If you're a young lady getting ready, thinking about childbearing, just keep in mind, be prepared. This is something you are at least you're likely to experience, or a good chance that you may experience it. There is postpartum depression, which is the second type. Postpartum depression occurs during the weeks and months after delivery, with symptoms including depression, loss of appetite, sleep disturbances, fatigue, suicidal ideation, loss of interest in life's activities, and a disinterest in the newborn child. Also leads to some feelings of guilt. Postpartum depression, most like postpartum blues, does fade over time. Finally, there is postpartum psychosis, the most serious of the 3. It is very rare. It is very rare. It is a very serious mental disorder that occurs in about 1 out of every 1,000 women who give birth. It is very similar. The symptoms are very similar to a serious bipolar depression, and is believed to be directly linked to childbirth. Can be serious enough to encourage infanticide or suicide. So if you look at the Andrea Yates story, the one who drowned her kids, we're probably not looking at postpartum depression with her. Chances are we were really looking at postpartum psychosis. Finally, we come to personality disorders, and for personality disorders, there's really only one that merits discussion in this context, and that is antisocial personality disorder. This is the one that is fairly similar to psychopathy, which is what we talked about, part one. The essential feature of a person with APD is a history of continuous behavior in which the rights of others is violated. Again, not isolated incidents, not once in a while, but continuous behavior. This is a constant behavioral pattern with the individual. For someone to be diagnosed with antisocial personality disorder, they must be at least 18 years of age and must have a history or a prior diagnosis of conduct disorder prior to age 15. Excuse me. Before an individual can be diagnosed with antisocial personality disorder, they must have, again, the pervasive pattern of disregard or the violation of the rights of others. This is indicated by any three of the following behaviors. A failure to conform to social norms or criminal law, reflected by frequent acts that are grounds for arrest. Could be an irritability or unusual aggressiveness, as indicated by repeated physical fights or physical assaults. Third on this list is consistent irresponsibility, as reflected in a poor work history or a failure to honor financial obligations. Fourth is an impulsivity or a failure to plan ahead. Fifth is deceitfulness, as reflected in frequent lying, use of aliases, conning others for personal profit or pleasure. And then sixth is a lack of remorse or guilt for wrongdoing, as indicated by indifference to or rationalization of having hurt, mistreated, or stolen from another. And understand you need to diagnose them with APD. They've got to, again, be 18 years old, have a history of conduct disorder prior to age 15, and three of those six characteristics that I just named. Antisocial personalities tend to be, or people with APD tend to be callous, tend to be cynical. They're very contemptuous of the feelings or rights or sufferings of others. It's not unlike the psychopath. They may understand. They may be able to process another person's feelings. They just don't care. They also tend to display aggressive sexual behavior, excessive drinking. They are commonly into drug use. Also with APD, there is a marked impairment or an impaired capacity to maintain lasting close relationships with friends, family, sexual partners. They just don't make long-term relationships. They can, unlike the psychopath, they can make attachments to individuals. They just can't make them last. APD is a common diagnosis of criminal defendants and offenders, accounting for as much as, let's say, 40% of all. If I were to group all of the people diagnosed with a mental disorder that come before the courts, 40% of them would be diagnosed APD. And part of this is because it tends to be a catch-all category. When we try to assume that an individual has some sort of disorder, but we can't put a name on it, and he meets three of these six criteria, we go, poof, we put a stamp on him, say APD, that's it. That's the person who's got antisocial personality disorder. That's their problem. Doesn't mean they are, but we make that assumption in the system. There is some doubt as to the validity of APD as a disorder, and it has, by some individuals, been accused as being moral judgment, or it's accused as being a moral judgment disguised as a clinical diagnosis. With individuals with mental disorder, there are some unique criminal defenses out there. I'm not going to talk about all of them, but I'll mention some. And the first one I'll mention is post-traumatic stress disorder, since that is one that, considering that the United States has been at war in one place in the world or another for at least the last 10 years, and we're starting to see more and more individuals coming back from Iraq and Afghanistan. They're being diagnosed with post-traumatic stress disorder. Let's talk about that one. This is the development of characteristic symptoms of post-traumatic stress disorder. Follow the exposure to extreme traumatic stress or involving direct personal experience of an event that involves the actual or threatened death or serious injury of an individual. Usually this is accompanied by intense fear, terror, and feelings of helplessness, i.e. combat situations. This is also a common diagnosis among police officers and correctional officers. Symptoms include flashbacks, reoccurring dreams or nightmares, painful, intrusive memories of the event causing disorder. There is also some psychological numbing to the external world. And so while the person suffering from post-traumatic stress disorder is constantly or continually reliving the traumatic event and feeling the emotions associated with it, that constant emotional pain is numbing them to the rest of the world. Imagine having a deep cut on your hand. If you pound on that cut, making it hurt over and over again, if you pour salt in it enough times, you eventually quit feeling it. Or maybe a better way to describe it is if you have a cut on your hand, it hurts really bad, and then I break your knee. The cut on your hand, you're kind of numb to the cut on your hand. Kind of way to think about it. Typically symptoms occur within weeks following the event, but that is not always the case. It is not unusual for symptoms to not appear until months after the traumatic event, maybe sometimes even years. PTSD, post-traumatic stress disorder, can result in sleep problems, difficulty concentrating or remembering, extreme avoidance of things or events that remind the person of the original traumatic event. People suffering from PTSD tend to be moody, tend to suffer depression. They tend to be fairly difficult people to be around, both in a social environment and in the workplace. Legally, PTSD has been used to lead to a finding of diminished capacity. It's been used to mitigate criminal responsibility, particularly in cases of abused spouses and other violent type offenses. Understand, when I talk about mitigating circumstance, we're not talking about excuses. We're not saying, okay, this guy has PTSD, we're not going to hold him responsible. But individuals that are diagnosed with having PTSD may be held less responsible for their actions. Another criminal defense, in fact, I'll talk about three. The second one is pathological gambler syndrome. This is the inability to resist the urge to gamble, despite dire consequences to daily living and personal relationships. May result as maybe an interesting criminal defense. There is something called dissociative. The third one we'll talk about is dissociative identity disorder. The old term for that is multiple personality. This is in theory anyway, this is the existence within one person of two or more distinct personalities. It's bad enough that I hate rap music, but it really disturbs me when people in the corner here think that I really want to listen to their music in their car. I don't know what makes them think that, but one of these days I'm going to invent my own personal electromagnetic pulse weapon, and I'm going to put it on the corner in my house, and every time someone comes by my house playing their music too loud, I'm going to set it off. Because as far as I know, there are no laws against putting forth an EMP pulse and destroying someone's car. At the very least, I don't know that the police could catch me. Well, except maybe Eric Navis and the other, and Wayne Matthews, who have now heard my plan. Damn. Where was I? For each personality state may be experienced as a distinctive personality, and they may or may not be aware of one another. Is dissociative personality or dissociative identity disorder a real disorder? We don't know. There's a great deal of debate in the scientific community about the existence of dissociative identity disorder. In some instances, it may be caused by the practitioners themselves, and that they interpret systems to fit that diagnosis.